Hi, this is Sabrina. We are reporting on the CMS, Center for Medicare and Medicaid Services. In our group is Nadia Schuning and myself. The history behind CMS in 1937 is when this started, actually, and it started with the U.S. Surgeon General Thomas Perrin, where he proposed that the National Health Insurance first started covering Social Security beneficiaries. Then in 1939, they started an organization called the Federal Security Agency that covered health, education, and social insurance offerings. In 1945, the Social Security Board called for the beneficiary health insurance by President Harry Truman, and he publicly lent his support for the national health insurances. And then in July 30th of 1965, President Lyndon B. Johnson signed the Medicare and Medicaid bill into law. Medicare started with two parts, Part A, hospital insurance, and Part B, medical insurance. The goal of the Medicare portion of the law was to give the elderly 65 and older better health care coverage. Medicare components now consist of Part A, hospital, Part B, medical insurance, which is outpatient visits, Part C for the disabled, and Part D for medications or prescriptions. So CMS jurisdiction. So what the jurisdiction is they have what they call a Medicare administrative contractor, which is a private healthcare insurer that is awarded an area to process Medicare and Medicaid claims. For example, Meridian is over 10 states, which include Idaho and Utah. As a healthcare organization, this is who you would contact when dealing with any Medicaid or Medicare issues. So examples of programs issued by CMS are value-based purchasing, MACRA, which is Medicare Access and CHIP Reauthorization Act of 2015, which is a newer program, readmissions, HAC, which is Hospital Acquired Conditions, the Nursing Home Quality Initiative, and the Ambulatory Surgery Quality Reporting Program. So this part I'm going to present for Shuning, and she's shared with these slides with me, and it's the benefits of CMS for Centers for Medicare and Medicaid Services. Medicaid is a jointly funded federal state health insurance program for low-income and needy people. It covers children, the aged, blind, or disabled, and other people who are eligible to receive federally assisted income maintenance payments.
So this part was the benefits of Medicare and Medicaid, and my name is Matt. Okay, so I did benefits, and I'm Nadia. And so Medicaid, I found it was a jointly funded federal state health insurance program for the low income and people who are more like in poverty or can't really afford really good insurance. And it covers children, older people, blind or disabled, and people who are eligible to receive federal assistance. And then Medicare is the federal health insurance where it covers from people 65 and older, and some people with disabilities who are younger, or people with like end of stage renal disease, which is like the permanent failure requiring dialysis or transplants. And then, okay, so some of the benefits that I found for employees was that they could have more flexible work schedules depending on their health, and like you get more days off. There's employee assistance programs and confidential programs that help people who are having problems on or off in their job, like health problems. And then you can go to the next slide. And then, so this is going to be more categorized. So the benefits for Medicare, residents of other free market countries pay less than half of the cost, and then they get quality health care for their entire lives. And then people with this tend to live longer because they can get more health insurance, is what I found. and there's no copays or deductibles. There's much lower like medicine prices, so when you go in to buy medicines, it's not super expensive. And again, healthcare costs are lower. And we can go to the next slide. And then this is like more of the benefits of like directly of what they will take care of. So primary care and prevention, approved nutrition, inpatient care and outpatient care. And when you go to the emergency room, it can cover that. Prescription drugs, long-term care, like when you're in hospitals or mental health facilities, dental services. It covers like therapies for substance abuse, basic vision correction, and hearing. And then for the benefits for Medicaid, and I found that this one varies by state, so I put an example for Idaho, and it like the qualifications in order to benefit from this program is like you have to be a resident of the state, a citizen, legal, and you have to be in need of that assistance. And your income has to be fairly low, and this is the one where you have to be 65 years or older or have like a specific disability if you're younger. And it also depends on like how much income you make. And like on the next slide is going to be an example of like the incomes that are before taxes that would qualify you to get Medicaid. And that's that. So that's just for reference. And then you can keep going. And then it provides a broad level of health insurance coverage, including doctor visits, hospital expenses, nursing, home care, and home health care. And then it covers more long-term costs as well, both in and out of the hospital. And Medicare doesn't provide that kind of coverage, so that's like a difference between the two. And then yeah, that was it on mine.
So I'm going to report this for Shoelings.
On this slide, Medicare. Okay.
Medicare Trust Fund. The Medicare program is the second largest social insurance program in the U.S. It has 55.3 million beneficiaries and total expenditures of $648 billion in 2015 alone. Hospital Insurance Trust Fund expenditures are $131.1 billion. Costs increase every year. Estimated annual growth is 6%. By 2030, the high Hospital Insurance Trust Fund balance at the beginning of the year as a percentage of annual expenditures will be depleted to 0% from the 140% that it started at in 1990. Projections and research studies. The Office of the Actuary often produces a 75-year projection of Medicare expenditures as an annual report. These reports have such a long-range projection for the public policy makers to promote understanding. In the 2016 Trustees Report, it is assumed that the elasticity for the 25th year of the projection period is 1.27 and declines at a slowing pace of 1.09. By the end of the 75-year projected period, this quote from CMS.gov shows that healthcare will continue to consume a greater proportion of income, and demand for additional healthcare spending and new technologies will lessen.